Thank you all very much for being here. We're here today to provide an update on how our city is responding to the coronavirus. Now, this is an unprecedented moment. We're really confronting two challenges at once: last week's tornado and now this, the coronavirus. I want the victims of last week's tornado to know that the Metro government and the entire community is committed to helping us recover and rebuild. 3 disaster assistance centers continue to operate to help answer questions and connect you with FEMA resources. We are making progress. Metro Public Works has cleared 92% of all blocked roadways, 100% of all blocked alleyways, and repaired 94% of all down traffic signals. NES is working to address less than 300 remaining customers without power. Now, that is down from 50,000 on March 3rd, so that is a lot of progress. My office has coordinated with local utilities and telecom providers to provide billing grace periods across the county to help ease financial burdens brought on either by the tornado or coronavirus. Now, last week we saw how Nashvillians responded to the tornado. We came together as a city, and now we are facing another challenge. One that will require an equally strong response, but in a different way. And that response is already underway. This afternoon, I've brought together our Public Health Director, Dr. Michael Caldwell, the Chair of our Health Board, Dr. Alex Yanger, one of the nation's leading experts on infectious diseases, Dr. William Schaffner, to give us an update on our citywide response strategy. We have the resources to meet this new challenge. Nashville is America's healthcare capital. Our city has some of the most brilliant medical minds anywhere, and Metro is working with our partners to ensure that our response plan is comprehensive. Now, today, my office will submit an amended capital spending plan to the council that includes additional funding for repairs to tornado-damaged buildings and contingency funds for dealing with the effects of the coronavirus. The virus, of course, is having an impact on our local economy, which will lead to lower tax revenues, particularly related to sales and hotel tax collections. We've been taking this particular challenge into account over the past several weeks as we formulate the budget and our financial projections. Now, for weeks, my office has been getting regular updates from the health department on the state of readiness of our coronavirus monitoring and response team. And this week, we've been involved in White House briefing calls with state and local governments. We've also convened a meeting with the leaders of all the hospitals in Nashville. And Dr. Yanger, who's also the head of our Public Health Commission, will talk more about what we're doing with them and with our state and national partners. I've also named Dr. Yanger to be the chair of Metro's Coronavirus Task Force, which will include leading clinicians, epidemiologists, and other community partners from both Metro government, educational institutions, hospitals, and other important stakeholders from throughout Nashville and Davidson County. As Executive Medical Director for the Vanderbilt Center for Trauma, Burn, and Emergency Surgery, Dr. Yanger is a respected surgeon and an organizational leader, and the Metro Coronavirus Task Force is in excellent hands under his leadership. Now, Metro government, schools, and businesses across the city are already taking steps to protect our residents and visitors. And I've met with business and event venue operators to discuss the protocols of social distancing. Now, NPS has canceled classes out of caution. The flea market has called off its last event in March. Our public library has postponed countywide events. And B&A continues its round-the-clock cleaning program and stands ready to implement any additional operational changes as directed by medical officials. Now, prudent measures are being taken to reduce the number of large public events as part of social distancing. Our health department is sharing information on how we could all protect ourselves from the coronavirus and what we should do if we are worried we have symptoms. You'll be hearing more about that from our 3 experts, Dr. Caldwell, Dr. Yanger, and Dr. Schaffner. And with that, I'll turn this event over to them. But I want to thank the community for this strong response that we have one more time, canceling events, following social distancing, and protecting our vulnerable population as we go forward and meet this additional challenge to Nashville. The whole country is facing it as well, but Nashville, we expect to handle it particularly well because we've shown that we can do this now several times. I appreciate it, and then thank you, Dr. Caldwell.
Thank you, Mayor Cooper, and good afternoon. The Public Health Nashville Metro Health Department is now investigating a total of 10 Davidson County cases of COVID-19. We fully expect the number of cases to increase as testing increases. I'm asking everyone to help us so you can do your part by remaining informed and continuing to take routine health precautions. This is especially important for those with any underlying health conditions and anyone age 60 and over. The best way to prevent the spread of respiratory viruses like COVID-19 is the advice we give you to reduce your risk of any germs. Wash your hands often, first with water, then with soap, for at least 20 seconds. If that is not available, you can use a hand sanitizer as a backup. Avoid touching surfaces unnecessarily. Try to avoid touching your face, eyes, nose, and mouth. If you are sick, please stay home. Please remove yourself from others as much as you possibly can. If you cough or sneeze, try to use a tissue and then immediately throw it in the trash. If that's not available, we advise you to use the crux of your elbow. Clean and disinfect frequently touched objects and surfaces. I also ask the community to find alternative ways to greet each other. You saw this here as we were greeting each other. We are trying to avoid shaking hands. We are using elbow bumps or some alternative greeting. We have been shooting public service announcements, which you'll see soon, with my advice to both NASH and TRAC on what they can do to help our community avoid the spread of germs. We have Dr. William Schaffner here with us. He is the Professor of Preventive Medicine and Infectious Diseases at Vanderbilt University Medical Center. And I'm grateful that he's here today. Dr. Schaffner, thank you.
Thank you, Michael. Mr. Mayor, thank you. Good to be here with all of you. I'd like to say a few words about where we are. Earlier this week, for example, the World Health Organization actually declared coronavirus 19 a pandemic. It's a word that should not evoke panic. It's a pandemic because it originated in one country and then has spread around the world. And in subsequent countries where it's been introduced, it's now spreading further. That's the definition of a pandemic. The use of the word is useful because it draws attention to every minister of health in every country and all of us here in the United States that this is a serious disease and we need to do everything we can to diminish its impact. Now, if we institute a vigorous response now, we can dampen the outbreak. That's the first goal. Dampen the outbreak, spread it out so that there's not a huge surge of medical care need at one time. If we can spread this out, then we can take better care of everyone. The other goal is to reduce the risk of transmission to the most vulnerable population. The most vulnerable population are those who get most seriously ill. Everyone age 60 and older. Seriousness increases with age. And then whether you're 60 or older or younger and you have any underlying disease, any chronic illness related to the heart, to the lungs, if you have diabetes, or if you're immunocompromised in any way. So we're trying to minimize the spread of the virus to those people. How do we do that? We don't have a vaccine for this disease yet, so we have to do what's very traditional in public health, that is, to try to prevent the spread. This is a respiratory virus. It's spread from person to person, as Dr. Caldwell said, on hands, and obviously by close proximity. If I have the virus in me and I breathe out microscopically, there will be viruses in what I exhale. If you're within 3 to 6 feet of me in what's called the breathing zone, and you inhale, and I hope you do, then you'll obviously inhale some of what I've exhaled, including the viruses, and they can be spread to you, and you can become ill. So the notion is, let's keep as much separate from each other so we don't infect each other. We'll reduce the risk of transmission in the community. That's called social distancing. We do it professionally at work and in business, and we also do it personally. And the easiest way to do that, it's easy to say, more difficult to do, is to avoid large group events, whether they are religious events, entertainment events, or business events. So all across the country, I'm impressed at how this has been accepted. Businesses, religious organizations and facilities, schools and others are now either closing down or making meetings not in person, but virtual. That's one way we can get space between us. In our own homes and in our own personal activities, it's similar. Let me give you an example. My wife was called by a friend of hers who happened to be out of state, and she was over 60, the friend, and asked whether she should attend a dinner, a celebratory dinner. I think it was a birthday dinner. 30 people would attend. Should she attend that dinner? I, who was overhearing the conversation, said, wait a minute, isn't everyone who attends that dinner going to be over 60? So the question is not whether so-and-so should attend that dinner, but whether that dinner should be held at all, because that's bringing a group of people who are all in the more vulnerable group together, face-to-face, in an enclosed room for a rather prolonged period of time, probably about 3 hours. That's exactly the kind of circumstance that we need to postpone today, because we don't want the opportunity, even if one of those persons at the dinner were carrying the virus, to spread it to everyone else. So let's keep things apart. We'd like to create Nashville as a hug-free zone for a while, so that we're all kind of elbow bumping, but hugging and kissing large numbers of people. Let's postpone that for a while. Businesses are minimizing meetings, as I've said. Houses of worship will make their own decisions, but once again, particularly if you're in a vulnerable group, be reverent at home is my suggestion, rather than joining the congregation for a few weekends. I think it's safe to go out in restaurants because you're there with just a friend or two or three. You have transient contact with your serving person, and that's a small group. We don't want everyone to go home, lock the door, and crawl under the bed. We don't want to turn ourselves into hermits, but just make reasonable adjustments to our personal lives. Go outside, get a little exercise, take a walk, enjoy yourself, enjoy life, but be prudent. Thank you very much. Dr. Janiger.
Thank you, Mayor Cooper, for asking me to take the lead in coordinating Nashville's response to this challenge. This is a true honor and a great responsibility for me. You know, Nashville is the community in which I grew up in, and it's the community in which I'm raising my children. This is home, and I'm committed to the success of this city. We are a strong community, and I know that we will get through this challenge together. Dr. Schaffner, sorry, we're socially distancing. Thank you so much for your advice. You know, Nashville is one of the healthcare capitals in the world, and we really are truly resourced here with amazing partners and academicians from all sectors of healthcare. Let me update you all now as to what we are doing and we are planning to do. Earlier this week, executives from the Metropolitan Public Health Department, Ascension Healthcare, HCA, Nashville General, Vanderbilt University Medical Center, the National Healthcare Corporation, or NHC, which operates skilled nursing and assisted living communities, the Tennessee Department of Health, Tennessee Hospital Association, and Metro Fire and EMS all met to discuss the best way to coordinate the response to this situation as a city. These organizations independently have been preparing for this moment for a month or so, or maybe longer. We now have an unprecedented cooperation amongst all these organizations to ensure the health of our community. And as we move forward, there will be other organizations who will also be included in this group. Areas that this group is working on include the following: development of accessible information, as well as a metro-wide hotline for information and guidance for anyone who is concerned about this virus. We're developing a plan for how we are scaling screening across our health systems in order to be in front of this in any way this escalates further. We are developing a data center that will be able to have access to real-time information regarding this situation across our city. And finally, I want to announce that we will be having daily calls and other media availabilities so that we have a chance to answer questions about this in a daily basis. So with that, I think we'll turn over to Mr.
Well, very quickly, Brian, before we get on to questions, I did want to just recognize two very important people in our response: Chief Swan, the head of our emergency management system, and Council Lady Hurt, chair of the health committee at the council, in order to have a unified metro-wide response to the challenges ahead of us on this in the weeks ahead. Thank you.